Walgreens or Walmart, what do you need to get? So very practical, primary care, grassroots sort of information here. You know, as a medical student, I remember seeing these striking pictures of patients with severe osteomalacia and rickets. Both considered by me, I thought, well, these are historical diseases. I'm not ever going to see this. I need to study it for my boards and sort of move on. And it was thought by many doctors in this country about 40 years ago that since we have fortified so many foods in this country, like cereals and milk and a lot of dairy products, baby formula even, that we would no longer see osteomalacia and rickets. I don't think my pediatrics faculty can correct me. I don't think we've seen much rickets, but we still continue to see some osteomalacia. Osteomalacia, for those of you who are non-physicians, is a disease caused by the decreased mineralization of newly formed sites at bone, and it's at sites of bone turnover. Whereas rickets is a disorder seen only in children, and it's a defective. There's also a problem with mineralization, but there's a problem of mineralization at the cartilage and the epiphyseal growth plates where children's bones grow. And so I'll just talk a little bit briefly more about that in a minute. So what do we know briefly about vitamin D metabolism? Here's, how is vitamin D made? How do we get it? How do we make it? When the sun's UV light, particularly UVB light rays, hit our skin, there's a reaction that takes place in our skin that enables the cells in our skin to manufacture and make vitamin D. And we do that because we already have something called 7-dehydrocholesterol in our skin. And then, so that's one way we get it. The second way that we get it is from our diet, right? And whether vitamin D is gotten from our diet or from dermal synthesis, that initial vitamin D is biologically inactive. So there's a couple of organs in the body that have to do stuff to it to make the vitamin D work. And the first thing that's got to be done in the liver is to convert that vitamin D to 25-hydroxy-D. The second thing that has to happen, and this is the major circulating form of vitamin D. The second thing that has to happen is that the kidney has to work on it. Of course, everything's about the kidney. And it converts it to 125-dihydroxy-vitamin D. And this is the one that's active. This is the one that binds to receptors in cells throughout our body. And it's not just in the bones as well. And so the end result, when you have adequate vitamin D, as the physicians in the room know, you will have adequate intestinal absorption of calcium. Now, what are some food sources of calcium? Like I said, almost all of the United States milk supply is fortified with about 400 IUs of vitamin D per quart of milk. But foods made from milk, like a lot of cheeses and my favorite McDonald's soft serve vanilla ice cream that's highlighted here in the middle of the PowerPoint, are usually not fortified. So we can no longer comfort ourselves that we eat ice cream every night and that's helping us take vitamin D. Get it off your list. It's not working. I just looked at my Haagen-Dazs in the freezer before I came here and it has no vitamin D in it, unfortunately. However, fatty fish like salmon, tuna, mackerel are pretty much among the best sources of vitamin D. Egg yolks will provide a small amount of vitamin D, and like I said, it's also added to breakfast cereals, orange juice, margarines, things like that. But you kind of have to seek that out at the grocery store. You have to look, okay, is this orange juice that I'm buying, is it calcium and D fortified? A glass of milk has about 100 IUs of vitamin D. Salmon, in comparison, has 1,000 IUs of vitamin D, so 10 times the amount. For those of you who are vegetarians, sun-dried shiitake mushrooms have more vitamin D than any other food product that I've found, and they have about 1,600 IUs of vitamin D in them. So just to kind of give you an idea of what you can take in your diet. So pretty much, your diet is limited here. It's pretty much limited to fatty fish. If you eat that, egg yolks, and dairy products that are fortified, pretty much. So it's not something that we can easily get in our diet. Who is at high risk for vitamin D deficiency? Well, first of all, the elderly, right? The elderly primarily because the enzyme in their skin that helps make that vitamin D is decreased. Number two, dark-skinned individuals. That includes pretty much most of us in this room as well. So the same thing that protects us from skin cancers is that similar mechanism that blocks vitamin D from getting absorbed. So you've got darker-skinned individuals. That's issue number one. People who live in northern latitudes. And I have this great picture, and it's a tribute to my husband. This picture here is a group of people who are at a New England Patriots game. And the purpose of that is people who are New England Patriot fans live in northern latitudes. And people who live in northern latitudes really have markedly less vitamin D availability from the sun. Actually, in the winter, if you live north of Atlanta, it is very difficult for you to make vitamin D from the sun because the UVB rays just don't penetrate in the winter time at least. And so if we checked all of our vitamin D levels in the winter and compared it to the summer, in the summer our levels would be somewhat higher in general. The other thing I'm reminded here by this picture is that people who cover, which tends to be a lot of Arabs, Indians, those of us who cover and don't walk, don't go around as exposed as people from other cultures, are also limiting ourselves to get vitamin D absorption as well. So why is vitamin D important? It's critical, as I've said, for mineralization of the bone, right? Without it, your bones can get soft, if you will, using a lay term, it'll get soft. As I've already said, it also increases the efficiency of the intestine's ability to absorb calcium. For example, if you're vitamin D deficient and you think you're really doing well by taking adequate amounts of calcium, your intestines are probably absorbing about 10% of that. So you really need the vitamin D on board to maximize your intake and absorption of calcium. Number 3, most tissues and cells in the body, like the brain, prostate, breast, and colon, all have vitamin D receptors, so it ends up, and respond to 1,25-dihydroxyvitamin D. And we'll talk a little bit about that in just a minute. And then also, whether it's directly or indirectly, vitamin D controls about 200 genes. And these genes are responsible for the regulation of the cellular proliferation of both normal cells and potentially malignant cells. And this is where a lot of people are hearing so much about vitamin D and cancer, which we'll talk about in just a second. The other group of people who don't get enough vitamin D rich foods are people who eat things like laddu and dal and idli and Bombay snacks, right? So our diet in general is markedly limited, and so that's also putting us at risk. So really, off the bat, we've got 3 risk factors for being vitamin D deficient, and we are considered a high-risk group, all right? So other consequences of vitamin D. There is fair or reasonable evidence of an association between lower serum vitamin D levels and an increased risk of falls in the elderly. And there have been several studies, which I don't have the time to go into the details of that. There have been several studies highlighting the connection between serum levels of vitamin D and bone mineral density. For example, for those of you who have low mineral density, bone densities, if you go to your doctor, your primary care doctor, endocrinologist, first thing they're going to do is going to check some labs, right? And one of the first things they're going to do is check vitamin D. And without adequate levels of vitamin D, they're not even going to treat you for osteoporosis yet. So this is how important vitamin D is in its role with osteoporosis. The reason why there's a lot of controversy and there's a lot of unclear areas with vitamin D deficiency, and does vitamin D deficiency directly cause this problem or does it directly cause that? Most of the randomized controlled trials, if you review them, pretty much include calcium with the vitamin D supplementation. So it's very hard to separate those two things out. There are very few randomized controlled trials that specifically look at vitamin D only and haven't had calcium in association with it. So most of the studies and the results of these studies that we've seen and the strong, large randomized controlled trials have typically used calcium with vitamin D. So it's hard for us to separate that out. Another consequence of vitamin D deficiency, musculoskeletal weakness. So it turns out that skeletal muscles also have vitamin D receptors and may require optimal or adequate amounts of vitamin D for maximal function. And weakness, as we know, particularly in the elderly, will contribute to increased risk of falls. Other consequences, I've already mentioned osteomalacia, which typically we're not going to see the overt severe osteomalacia that we read in those textbooks when we were medical students. But typically we're going to see patients who present with bone pain. A lot of patients say, oh, my bones ache all over, my joints ache all over, I feel very weak. And in these kinds of patients, it's totally appropriate to, as part of the workup, definitely get a vitamin D level. And it's regardless of the etiology, right? It's regardless of why people are having the diffuse pain or bone pain or the osteomalacia. We always check a vitamin D on that. Excuse me. I put a question mark here before I talk details about the consequences of vitamin D deficiency. There's a lot of talk of a lot of my patients, who watch Oprah and Dr. Oz and CNN, they watch the news, and they come to me and they say, you know what, we know that vitamin D deficiency can also cause heart attacks. Well, that's one thing, these are areas where we really don't have a lot of large randomized controlled trials that will show that this actual deficiency causes this disease, right? There have been prospective and retrospective epidemiological studies that have shown a connection between vitamin D deficiency, hypertension, and they think it has to do with the renin-angiotensin system and the vitamin D receptors on that, atherosclerosis, potentially because of its role in peripheral vascular disease, diabetes type 1 and 2, and then, as I've already mentioned, the breast cancer and colon cancer. There are some epidemiological studies that have cited that patients who have vitamin D levels less than 20 have a 30 to 50% increased risk associated with that for colon cancer and breast cancer. But again, these are all epidemiological studies, and so as we know, it's very hard to create causality and say this deficiency definitely causes this disease. There's an association out there, these associations are definitely there. Can we clearly say, can I clearly tell my patients that vitamin D deficiency causes these conditions? No, not yet. But that's what's in the news, that's what people are talking about, and so a lot of my patients are coming to me with this specific question. How am I on time? Okay. What forms of vitamin D supplements are out there, right? Both D2 and D3 are manufactured in over-the-counter supplements. Vitamin D2 is the one that a lot of you are on. We're on 50,000, the large doses. Vitamin D3, as I've said, is naturally present in the foods that we eat, and it's made from our skin. D2 is made from plants after they have exposure to UV. Vitamin D, I typically tell my patients to take the vitamin D3. It's the easiest, most abundant vitamin that you'll see if you go to Walmart or Walgreens. How much vitamin D should we all be getting? According to the Institute of Medicine guidelines, every one of us should be getting at least 600 international units per day. If you are high risk, meaning and above 70 years of age, the recommendation at this point is 800 international units per day. How should we take it? Well, you got some options, right? If you're vigilant and you're very conscientious about what you're eating, then you could consume at least 4 servings of dairy per day, plus eat a balanced and varied diet, including eggs and fish and foods like that, plus 10 minutes of sunlight exposure per day. Now, for most of us, this third option is a little bit tough. If you're fair-skinned, experts say going outside for 10 minutes in the midday sun, in shorts and a tank top, with no sunscreen, will give you enough radiation to produce about 10,000 international units of vitamin D. If you are darker, you may need 15 to 20 minutes of sunlight, midday. How many of us can stop midday and go out and say, I'm just going to take a break and go out in the sun and just enjoy myself for 20 minutes and take some vitamin D? Not very realistic. So a lot of people choose the supplements, right? And so the supplementation that we recommend as a preventive dose is 600 to 800 IUs vitamin D pills with calcium daily. So if you choose the dietary route, I think that's fantastic, but a lot of people will choose the supplement. Briefly, how is vitamin D deficiency defined? Although there's no clear consensus on optimal levels of 25D, it's defined by most experts and organizations as a level less than 20. If your doctor checks your vitamin D level, it's less than 20, you're deficient. Between 20 and 29 or 30, you're insufficient. So you're okay. And then above 30 is optimal. And because of its long half-life, we measure 25 hydroxy-D and not the 125. What if you are vitamin D deficient? We're going to put you on 50,000 IUs of vitamin D every week for about 8 weeks. We'll recheck your levels after about 8 weeks. If you're at the level we want you to be, then we're going to have you probably continue at that 50,000 dose monthly for a maintenance dose. By the way, how much calcium should we all be consuming? I know I'm not here to talk about calcium, but I just have to say it. All of us should be on at least 1,000 milligrams daily in divided doses. And remember, one serving of something is about 8 ounces, right? So I'll have a lot of my patients come and say, yeah, I have curds with my dog every day. And I say, how much yogurt do you have? A tablespoon. Have a good tablespoon of yogurt. Yeah, that's not going to cut it. If you're counting on that being your calcium replacement, you're going to need to take a little bit more than that. Roughly one serving of a dairy product, whether it's yogurt or milk, typically is about 250 to 400 milligrams of calcium a day. If you get 1 cup of yogurt, that's your best bet at 400 milligrams. Skim milk and buttermilk is about 300 milligrams of calcium in it. So this is how much we should all be consuming. I reviewed briefly with you all the vitamin D levels. For the sake of time, I've just touched on some of the studies. I'd be happy to go into some of those later with you if you have any questions about them. But I'm hoping that the take-home point for everybody today is that everybody make sure that they're getting at least 600 to 800 international units of vitamin D a day, whether you get that through your diet or you get that through a supplement that's over the counter, and that should be vitamin D3, which is the easiest to get. Make sure you're getting 1,000 milligrams of calcium a day. Remember, don't take all 1,000 at the same time at once, because you're not going to absorb it all. So usually 500 milligrams of calcium in the morning, 500 milligrams of calcium in the evening.